2026 Mental Health Psychiatric Nursing Practice Review. Question 1. Which medication is typically prescribed for the treatment of attention deficit/hyperactivity disorder (ADHD)? Option A. Haloperidol. Option B. sertraline. Option C. methylphenidate. Option D. clozapine. The correct answer is option C. Methylphenidate. Methylphenidate is a central nervous system stimulant often prescribed to manage symptoms of ADHD. It works by increasing the activity of certain neurotransmitters in the brain, helping to improve focus, attention. Question 2. During a panic attack, what is the nurse's priority intervention for a patient with panic disorder? Option A. Encourage the patient to verbalize their feelings. Option B. Provide reassurance and stay with the patient. Option C. Leave the patient alone to calm down. Option D. Distract the patient with a task. The correct answer is option B. Provide reassurance and stay with the patient. During a panic attack, the priority intervention for the nurse is to provide reassurance and stay with the patient. This action helps reduce fear and provides a sense of safety, which can aid in calming the patient. Question 3. You have been working closely with a patient for the past month. Today he tells you he is looking forward to meeting with his new psychiatrist but frowns and avoids eye contact while reporting this to you. Which of the following responses would most likely be therapeutic? Option A. A new psychiatrist is a chance to start fresh, I'm sure it will go well for you. Option B. You say you look forward to the meeting, but you appear anxious or unhappy. Option C. I noticed that you frowned and avoided eye contact just now. Don't you feel well? Option D. I get the impression you don't really want to see your psychiatrist, can you tell me why? The correct answer is option B. You say you look forward to the meeting, but you appear anxious or unhappy. Choice B is the most therapeutic response as it acknowledges the discrepancy between the patient's verbal statement and nonverbal cues. By addressing both the patient's expressed anticipation and the conflicting. Question 4. Maggie, a child in protective custody, is found to have an imaginary friend, Holly. Her foster family shares this information with the nurse. The nurse teaches the family members about children who have suffered trauma and knows her teaching was effective when the foster mother states. Option A. I understand that imaginary friends are abnormal. Option B. I understand that imaginary friends are a maladaptive behavior. Option C. I understand that imaginary friends are a coping mechanism. Option D. I understand that we should tell the child that imaginary friends are unacceptable. The correct answer is option C. I understand that imaginary friends are a coping mechanism. Imaginary friends can serve as a coping mechanism for children, especially those who have experienced trauma. They can provide comfort and a sense of control in challenging situations. Acknowledging and supporting. Question 5. A female patient diagnosed with schizophrenia has been prescribed a first-generation antipsychotic medication. What information should the nurse provide to the patient regarding her signs and symptoms? Option A. Her memory problems will likely decrease. Option B. Depressive episodes should be less severe. Option C. She will probably enjoy social interactions more. Option D. She should experience a reduction in hallucinations. The correct answer is option D. She should experience a reduction in hallucinations. First-generation antipsychotic medications are effective in reducing hallucinations in patients with schizophrenia. These medications primarily target positive symptoms such as hallucinations and delusions. Question 6. The mental health team is determining treatment options for a male patient experiencing psychotic symptoms. Which question shouldn't the team answer to determine whether a community outpatient or inpatient setting is most appropriate? Option A. Is the patient expressing suicidal thoughts? Option B. Does the patient have intact judgment and insight into his situation? Option C. Does the patient have experiences with either community or inpatient mental health care facilities? Option D. Does the patient require a therapeutic environment to support the management of psychotic symptoms? The correct answer is option C. Does the patient have experiences with either community or inpatient mental health care facilities? Assessing suicidal thoughts, judgment, insight, and the need for a therapeutic environment are crucial factors in determining the appropriate treatment setting for a patient experiencing psychotic symptoms. Past. Question 7. Which of the following would be the most appropriate intervention for a patient experiencing severe anxiety? Option A. Encourage the patient to talk about their feelings. Option B. Use a firm, authoritative approach. Option C. Stay with the patient and provide a quiet environment. Option D. Suggest the patient watch TV to distract themselves. The correct answer is option C. Stay with the patient and provide a quiet environment. During a severe anxiety episode, it's crucial to stay with the patient and create a quiet environment. This approach helps reduce anxiety by providing a sense of safety and support, encouraging the patient to talk. Question 8. In a patient with bipolar disorder, which symptom would indicate a manic episode? Option A, excessive sleeping. Option B, low self-esteem. Option C, decreased need for sleep. Option D, anhedonia. The correct answer is option C, decreased need for sleep. The correct answer is C, decreased need for sleep. A decreased need for sleep is a hallmark symptom of a manic episode in bipolar disorder. During manic episodes, individuals may experience significantly reduced. Question 9. A patient with schizophrenia is prescribed clozapine. Which potential side effect requires regular monitoring? Option A, weight loss. Option B, hypertension. Option C, granulocytosis. Option D, hyperthyroidism. The correct answer is option C, granulocytosis. When a patient with schizophrenia is prescribed clozapine, regular monitoring for granulocytosis is essential. Granulocytosis is a severe reduction in white blood cells that can be life-threatening. Monitoring. Question 10. A patient with major depressive disorder is started on venlafaxine. Which class of antidepressant does this medication belong to? Option A, selective serotonin reuptake inhibitors, SSRIs. Option B, tricyclic antidepressants, TAS. Option C, monoamine oxidase inhibitors, MAOIs. Option D, serotonin norepinephrine reuptake inhibitors, SNRIs. The correct answer is option D, serotonin norepinephrine reuptake inhibitors, SNRIs. Venlafaxine is classified as a serotonin norepinephrine reuptake inhibitor, SNRI. SNRIs work by increasing the levels of both serotonin and norepinephrine in the brain, which helps alleviate symptoms of depression. Question 11. During cognitive behavioral therapy, a 12-year-old patient reports to the nurse practitioner. Option A. I was so mad I wanted to hit my mother. Option B. I thought that everyone at school hated me. That's not true. Most people like me and I have a friend named Todd. Option C. I forgot that you told me to breathe when I become angry. Option D. I scream as loud as I can when the train goes by the house. The correct answer is option B. I thought that everyone at school hated me. That's not true. Most people like me and I have a friend named Todd. In cognitive behavioral therapy, recognizing and challenging negative thoughts is crucial for progress. Choice B demonstrates the patient's ability to identify and correct distorted thoughts, indicating positive. Question 12. A patient with obsessive-compulsive disorder, OCD, is performing a ritualistic handwashing routine. What is the nurse's best initial response? Option A, interrupt the ritual to help the patient gain control. Option B, allow the ritual but set limits on the duration. Option C, ignore the behavior to avoid reinforcing it. Option D, encourage the patient to stop the ritual and discuss their feelings. The correct answer is option B, allow the ritual but set limits on the duration. In managing a patient with OCD engaging in ritualistic behaviors like handwashing, the nurse's best initial response is to allow the ritual but set limits on the duration. This approach helps in managing the behavior. Question 13. Which intervention is most appropriate for a patient with a phobia of flying? Option A, exposure therapy. Option B, cognitive restructuring. Option C, medication management. Option D, psychoeducation. The correct answer is option A, exposure therapy. Exposure therapy is considered the most appropriate intervention for a patient with a phobia of flying. This therapeutic approach involves gradually exposing the individual to the feared stimulus, in this case. Question 14. Which statement by the patient indicates a need for further teaching regarding the treatment of major depressive disorder? Option A. I have been on this antidepressant for 3 days. I understand that the full effect may take weeks to occur. Option B. I am going to ask my nurse practitioner to discontinue my Prozac today and let me start taking a monoamine oxidase inhibitor tomorrow. Option C. I may ask to have my medication changed to Wellbutrin due to the problems I am having being romantic with my wife. Option D. I realize that there are many antidepressants and it might take a while until we find the one that works best for me. The correct answer is option B. I am going to ask my nurse practitioner to discontinue my Prozac today and let me start taking a monoamine oxidase inhibitor tomorrow. Choice B indicates a need for further teaching because the patient is planning to switch directly from Prozac, an SSRI, to a monoamine oxidase inhibitor MAOI without allowing for a washout period. This abrupt. Question 15. Which response by a 15-year-old demonstrates a common symptom observed in patients diagnosed with major depressive disorder? Option A. I'm so restless. I can't seem to sit still. Option B. I spend most of my time studying. I have to get into a good college. Option C. I'm not trying to diet, but I've lost about 5 pounds in the past 5 months. Option D. I go to sleep around 11 p.m. but I'm always up by 3 a.m. and can't go back to sleep. The correct answer is option D. I go to sleep around 11 p.m. but I'm always up by 3 a.m. and can't go back to sleep. Major depressive disorder (MDD) is characterized by persistent sadness, anhedonia, and neurovegetative symptoms like sleep disturbances, appetite changes, and psychomotor agitation or retardation. The correct Question 16. Which characteristic identified during an assessment serves to support a diagnosis of disruptive mood dysregulation disorder? Select one that doesn't apply. Option A, female. Option B, 7 years old. Option C, comorbid autism diagnosis. Option D, outbursts occur at least once a week. The correct answer is option C, comorbid autism diagnosis. Characteristics such as age, frequency of outbursts, and occurrence in multiple settings support a diagnosis of disruptive mood dysregulation disorder, while comorbid conditions like autism can coexist with. Question 17. During a manic episode, which nursing intervention is most appropriate? Option A, encourage group activities to increase socialization. Option B, provide a structured environment with limited stimuli. Option C, allow the patient to engage in physical activities freely. Option D, give the patient detailed and complex tasks to complete. The correct answer is option B, provide a structured environment with limited stimuli. During a manic episode, individuals may experience heightened energy levels and reduced impulse control. Providing a structured environment with limited stimuli is the most appropriate nursing intervention. Question 18. A patient with agoraphobia is unable to leave home. Which intervention should the nurse prioritize? Option A, teach the patient relaxation techniques. Option B, gradual exposure to feared situations. Option C, encourage the patient to attend social gatherings. Option D, provide education about the disorder. The correct answer is option B, gradual exposure to feared situations. For a patient with agoraphobia, the priority intervention should be gradual exposure to feared situations. This approach helps the patient confront and gradually overcome their fear of leaving home. Question 19. Substance abuse is often present in individuals diagnosed with bipolar disorder. Laura, a 28-year-old with a bipolar disorder diagnosis, chooses to drink alcohol instead of taking her prescribed medications. The nurse caring for this patient recognizes that option A, anxiety may be present. Option B, alcohol ingestion is a form of self-medication. Option C, the patient is lacking a sufficient number of neurotransmitters. Option D, the patient is using alcohol as a coping mechanism. The correct answer is option B, alcohol ingestion is a form of self-medication. Individuals with bipolar disorder may turn to alcohol as a form of self-medication to cope with their symptoms. This behavior is often seen as an attempt to manage mood swings and alleviate distress. It is important. Question 20. Carolina is surprised when her patient does not show for a regularly scheduled appointment. When contacted, the patient states, "I don't need to come see you anymore. I have found a therapy app on my phone that I love." How should Carolina respond to this news? Option A. That sounds exciting, would you be willing to visit and show me the app? Option B. At this time, there is no real evidence that the app can replace our therapy. Option C. I am not sure that is a good idea right now, we are so close to progress. Option D. Why would you think that is a better option than meeting with me? The correct answer is option A. That sounds exciting, would you be willing to visit and show me the app? Carolina's best response is A. That sounds exciting, would you be willing to visit and show me the app? Because it demonstrates openness, curiosity, and a patient-centered approach. By validating the Question 21. A patient being treated for insomnia is prescribed Ramelteon, Rosarum. Which comorbid mental health condition would make this medication the hypnotic of choice for this particular patient? Option A, obsessive-compulsive disorder. Option B, generalized anxiety disorder. Option C, persistent depressive disorder. Option D, substance use disorder. The correct answer is option D, substance use disorder. The correct answer is D, substance use disorder. Ramelteon is preferred for patients with substance use disorder because it lacks abuse potential. This makes it a safer choice for individuals with a history of. Question 22. Which characteristic in an adolescent female is sometimes associated with the prodromal phase of schizophrenia? Option A, constantly afraid another student will steal her belongings. Option B, an unusual interest in numbers and specific topics. Option C, demonstrates no interest in athletics or organized sports. Option D, appears more comfortable among males. The correct answer is option B, an unusual interest in numbers and specific topics. During the prodromal phase of schizophrenia, individuals may exhibit subtle changes in behavior or interests. An unusual interest in numbers and specific topics may be a sign of cognitive disturbances that can. Question 23. A nursing student new to psychiatric mental health nursing asks a peer what resources he can use to identify the symptoms present in a specific psychiatric disorder. The best answer would be Option A, Nursing Interventions Classification, NIC. Option B, Nursing Outcomes Classification, NOC. Option C, NANDI Nursing Diagnoses. Option D, DSM-5. The correct answer is option D, DSM-5. The DSM-5 is the standard classification of mental disorders used by mental health professionals in the U.S. It provides criteria for diagnosing different psychiatric disorders based on symptoms and clinical. Question 24. Which assessment question asked by the nurse demonstrates an understanding of comorbid mental health conditions associated with major depressive disorder? Select one that doesn't apply. Option A. Do rules apply to you? Option B. What do you do to manage anxiety? Option C. Do you have a history of disordered eating? Option D. Do you think that you drink too much? The correct answer is option A. Do rules apply to you? Questions about anxiety management, disordered eating, and alcohol use are relevant to identifying comorbid conditions with major depressive disorder, but the question "Do rules apply to you?" does not directly. Question 25. Which therapeutic intervention is most effective for social anxiety disorder? Option A, group therapy. Option B, behavioral rehearsal. Option C, cognitive behavioral therapy. Option D, medication management. The correct answer is option C, cognitive behavioral therapy. Cognitive behavioral therapy (CBT) is considered the most effective therapeutic intervention for social anxiety disorder. CBT helps individuals identify and change negative thought patterns and behaviors associated